us today about measuring patient experience. Rachel, please feel free to take it away.
Thank you, Catherine. Thank you so much for having me here. Catherine, you stole some of my thunder, but that's okay. So good afternoon. My name is Rachel Silsdorf. I'm a student here in the Doctorate of Healthcare Administration program. In addition to pursuing my doctorate, I also work full-time in healthcare as a patient experience leader at a large urban trauma center. As you might imagine, when I started my program in the winter of 2020, I had not received the memo about the coming pandemic. It's been an interesting time to work in patient advocacy and certainly a challenging time to pursue this degree. I'm grateful to many of the faculty members here, my colleagues, fellow students, and my amazing family for their support. I'm just a few weeks away from taking my comprehensive exams, and although I understand that the hardest work is yet to come, I couldn't be more excited to begin my research. We're challenged during our dissertation phase to make a substantial contribution to our field. And that, my friends, is exactly what I intend to do. Shortly after the turn of the century, healthcare influencers, including the World Health Organization, or WHO, which is the organization that sets the global healthcare agenda, began to talk about the importance of including patient perspectives as a critical component and measurement of healthcare quality. In the US, the Centers for Medicare and Medicaid Services, CMS, which is the largest payer for virtually every health system in the country, partnered with the Agency for Healthcare Research and Quality to develop the first of its kind initiative to offer a national standardized forum for consumers to compare hospitals using standard and publicly available criteria. This initiative resulted in the 2008 development of the Hospital Consumers Assessment of Healthcare Providers and Services. Try saying that 3 times fast. That's why we commonly refer to it as HCAHPS. Understanding that simply creating the survey might not be enough to encourage health systems to focus improvement efforts in the area, HCAHPS became a prominent focus of attention when value-based purchasing was introduced to US healthcare in 2010 under the Affordable Care Act, with the basic premise being that instead of CMS simply paying the same amount for every Medicare patient per service, there'd be a series of bonuses or penalties paid or withheld respectively to encourage better healthcare quality. Approximately 30% of these value-based purchasing bonuses and penalties are determined based on the responses to the HCAHPS survey. So far, so good, right? Hospitals, as you might imagine, stood up and took notice. As an industry, we began to base quality improvement projects on our experience ratings. We even linked these scores to payments to clinicians in order to drive positive change. We want our patients to be treated well. We want to encourage health literacy by driving human connection fueled by empathy and compassion. After all, this can only benefit us all as potential healthcare consumers and create loyalty to our health systems. However, along the way, there have been a few hiccups. Some challenges have emerged. The response rate for the HCAHPS surveys, which was a fairly robust 32.5% in 2008, dropped substantially to 27% 10 years later and has continued to drop every year since, clocking in at an anemic 17% nationally in 2020. That means for every 5 patients in the hospital, we might get 1 survey back. In 2016, research revealed that while patients are asked about a variety of topics on the survey, there are an additional 11 areas that are really important to them based on the online reviews that they leave that the HCAHPS surveys don't even touch. And that these items included things like price transparency, patient access, wraparound services, to name just a few. Perhaps most significantly, we learned through a number of research studies that different subpopulations interact very differently with the survey. For example, a 2018 study revealed that if you're an English as a second language speaker, you are even less likely than the average hospital consumer to return that survey. As I began to get close to the end of my coursework, I started to really think seriously about my dissertation. Like many doctoral students, I came into the program with some ideas of what I wanted to study. As I progressed and my various courses led me to challenge what I thought I knew and to ask more questions, I had the opportunity to learn more about the history of HCAHPS and to begin to understand the methodology of the survey, what it is and isn't adjusted for. As my own understanding evolved, one central issue continued to bubble up. Knowing what I now know, I began to truly ask, how representative is the sample really? Looking at the published data, it would seem that the average US hospital patient is a white woman over the age of 55 with at least a college degree. Anecdotally, this seems untrue to me. Looking around the hospital, it feels wrong. The more I read, the more I understand what is adjusted for and what isn't, the more questions are raised. If HCAHPS are meant to be the way we encourage health systems to look at their processes and the care they offer through the eyes of the patient, isn't it crucial for us to make sure all the voices are heard? My doctoral research will seek to answer the central question of the representativeness of the survey sample. Ultimately, if nearly a third of the value-based purchasing dollars awarded as bonuses or withheld as penalties are based on HCAHPS scores, and we know that subpopulations respond to surveys in ways that differ substantially from white women over the age of 55 with at least a college degree, then we ought to be darn sure that the survey is giving us a full and accurate portrait of the perspectives of our actual patient population. Otherwise, tax dollars, essentially our dollars, are being spent on the statistical equivalent of, I want to speak to your manager. Thank you for your attention. I look forward to discovering and sharing these answers. And I'm happy to take a few questions. It looks like I have just a few minutes left.
Yes, Rachel, thank you so much. Comprehensive and insightful as always. So thank you so much for being here today. Does anyone have any questions? I'm not seeing any in the chat.
I just want to, Rachel, I loved that. I absolutely love that. I have so many issues with the value-based pricing and how value is being attributed. So this was wonderful, and I'm looking forward to more of your research there. I just wanted to share that. I enjoyed it immensely.
I also work in the hospitals, and I would agree with you. Certain populations will answer the discharge questions and provide feedback, whereas some, almost even most, has been my experience, won't fill them out. So, and it's unfortunate that the funding can be tied to the survey completion rate. So, yeah.
Absolutely. Thank you for that.
I can't wait to look forward, and I look forward to your findings.
Thank you.
Absolutely.
Rachel, I wanted to point out that in the chat, John L. Kellner says, I worked at a pediatric hospital in Los Angeles. They had a similar issue and started making the surveys in multiple languages.
Yes, so surveys are available in multiple languages. Unfortunately, it hasn't increased the amount of response by the various populations. Disappointingly, we found that even when the surveys are translated, there are certain subpopulations that don't respond. I think we have an ethical responsibility as an industry to answer the question about representativeness.
I just want to throw this out here and then I'll be quiet. This leads to some other research that we may want to consider socioeconomic background, literacy, and then the response, and how that plays into the value-based pricing. But that's all.
Cicely, I am so with you. There are so many questions that I want to answer. I feel like I have to start here, right? First, we have to know, is the survey representative of the population? And there are so many places to go from there. These are important questions. We have to answer them.
I
Yes,
also think that it was important when you talked about having the surveys in different languages. I just literally had that conversation at my job. We have a English as a second language patient that we've been helping. And it was a question as to her understanding as to what was being conveyed. And I'm like, put it in a language that she understands. Like if I
Right.
gave you a manual or a treatment plan and it was in a different language, would you be able to understand it and retain it? Probably not. So yes, I think that that's important. Some hospitals are doing that, whereas others are still behind.
Absolutely. Absolutely. And also, as Americans, it's really important for us to understand that not every language is a written language. So just translating it into the home language of a particular patient may or may not solve the problem.
Very true.
yes. Rachel, again, thank you so much. Wonderful presentation, wonderful discussion. And we just